Hello and a very warm welcome to a brand new edition of the WION VOA co-production. I'm Molly Gambhir. As the United States nears reaching its goal of vaccinating 200 million Americans by the end of April, the Biden administration is taking more steps towards helping other nations by appointing a coordinator for its global COVID-19 response. White House correspondent Patsy has the story.
By April 19th, all adults in the U.S. will be eligible to get the vaccine, announced President Joe Biden, 2 weeks earlier than his original May 1st deadline.
We're now administering an average of 3 million shots per day, over 20 million shots a week. On Saturday alone, we reported more than 4 million shots were administered. We're the first country to administer 150 million shots and the first country to fully vaccinate over 62 million people.
Under pressure from other countries to share vaccines, earlier this week Biden appointed Gail Smith as coordinator for the administration's global COVID-19 response. Smith is a global health expert who has advocated for shipping surplus vaccines abroad.
American leadership is desperately needed, and I'm extremely confident we can rise to the occasion.
While many lower and middle-income countries have begun inoculating with Chinese vaccines and doses coming from COVAX, the UN's global vaccines sharing mechanism, experts say there is still a lot the U.S. can do beyond providing surplus doses.
It can help grow manufacturing capacity as a goal. It can bring order and transparency to a vaccine marketplace around the world that is untransparent, chaotic, and unaccountable at the moment.
On Tuesday, Biden also visited a vaccination site at a chapel in Virginia. His administration has launched a coalition of religious and community leaders to help persuade Americans reluctant to get vaccinated, around 20% according to polls. Americans are also increasingly defying health protocols, including many who celebrated a college basketball victory earlier this week.
We have over 60,000 new cases occurring every day, and younger adults now are the vectors. They are spreading this virus. They're going to ball games. They're going to restaurants and bars.
According to the White House, about 40% of adults in the U.S. have received at least one dose, and almost 20% of the total population is fully vaccinated. Patsy Widakuswara, VOA News.
And for more on these developments is Voice of America Washington, D.C. correspondent Amy Hybels. Hi, Amy. The director of the U.S. Centers for Disease Control and Prevention says a variant of the coronavirus originally identified in the UK is now the most common strain of the virus circulating in the United States. Help us better understand just how concerning this is for the authorities.
Well, sure. CDC Director Rochelle Walensky says this strain has shown to be highly transmissible and infectious among younger people. So what's so concerning is here in the U.S., we're seeing a rising number of cases in young people. At the same time, that's coinciding with the UK strain becoming the most common form of COVID right here in the U.S. at this time. Now, Walensky says they're seeing cases of coronavirus clusters in youth sports and daycare centers. So what she's asking the states to do is if they see rising case numbers in young people, she's asking them to reduce the number of youth sports if they can't play outdoors or socially distance, be at least 6 feet apart from each other. She wants them to try to make those adjustments. Now, as you know, every state in this country has responded differently throughout the pandemic. For example, a group in Michigan called Let Them Play is suing the state because they don't like the mandatory COVID testing for high school athletes. So they're going up against the state leaders. They want that law to change. They don't want these kids to have to test. Now, speaking of high schools, just this week, in fact, a girls' high school basketball team in Hemlock, Michigan had to drop out of the state finals, much to their disappointment because one of their team members tested positive for COVID-19. They were not allowed to play in the semifinals because of this. So what we're starting to see is in these individual states, we're seeing student athletes being impacted by the COVID-19 virus both on and off the court. So this isn't just an illness that's affecting our senior population. It's a real concern among young people. And the states are grappling with their sports associations and how do they handle this at this level. Now, I wanted to let you know that it's important to understand that here in the U.S., the federal government does not dictate how each state is to respond. In fact, a lot of the decisions in regard to policy are left up to states, not the federal government. And since governors are elected along party lines, Democrat or Republican, each state, depending on its governor, may have differing policies. I'll give you an example. When I was moving to Washington, D.C. from the state of Michigan, I could stay overnight at a hotel in Ohio. That was fine during the pandemic, but I couldn't stay overnight in the state of Pennsylvania as I was making my way to Washington, D.C., unless I had taken a COVID test showing I tested negative. So that just shows that even as you cross borders, how different it is as you go from state to state.
Right. While the federal government cannot force states to enact particular policies, it can certainly talk about the importance of getting vaccinated. What can you tell us about the administration's efforts and the measures that have been taken to address concerns and worries about receiving the jab, vaccine hesitancy overall?
Yeah, well, Molly, last week the Biden administration launched what's called the We Can Do campaign. Recent polls have indicated a hesitancy to get the COVID vaccine, I should say, among white evangelicals. Now, when the vaccine first became available, there was actually concern that black Americans may be hesitant to take them due to historic racism-related mistrust of government health initiatives. However, recent surveys show that black Protestants are actually more likely to take the vaccine than white evangelicals. Now, this new campaign that the White House is launching will also target the Spanish-speaking population here in the U.S. They're going to launch television ads that are being produced in both English and Spanish. They're also going to push heavily on social media, Facebook, Twitter, Instagram. As you know, that's where a lot of Americans live these days. They're doing something else that's kind of unique. They're going to be relying on what they're calling community tours. They're going to bring together famous athletes, faith leaders, and medical doctors and have them reach out to the community. The thought seems to be that people are most likely to listen to their local doctors or their local pastors than politicians when it comes to learning about how effective the 3 vaccines actually are. Now, a new poll that was just released from the Associated Press NORC Center for Public Affairs Research finds that 3/4 of American adults now say they have or will get a vaccine. That's pretty good. So the numbers are definitely moving in the right direction. They're also throwing some money at this. The Centers for Disease Control and Prevention announced that it's going to devote $3 billion, billion with a B, to community outreach. So they're putting their money where their mouth is.